Horse Plus gave out a grant for gelding procedures in Costa Rica, and we've been chosen to travel there to show you guys the global impact the grant program is making.
We're at the Universidad Nacional, which is the national university centered here in San Jose, actually Heredia. This is the veterinary campus for UNA. All of our equipment gets stored here. We've got about a 6-hour drive today down to the La Casona region, an indigenous region in the south of the country. I am Neil Gray. I am a veterinarian. I had an equine practice in the Los Angeles, California area for 35 years. Stepped away from practice a couple of years ago. Started being involved with the Equitarian Initiative about 10 years ago now. So the Equitarian Initiative is a 501c3 corporation, charitable organization, dedicated to working horse welfare as well as educating veterinary students, as well as animal health workers and others who help take care of those working horses. In the last few years, the Equitarian Initiative has really expanded our educational programming. Our focus tends to be more on areas where the students in the countries that we're working oftentimes are not getting much of an education about horses. Their veterinary curricula, oftentimes those are governmental schools, and they don't include horses in their curriculum because horses are not considered production animals. So many of the governmental schools only focus on animals that are considered farm animals. And even though most of the animal production that occurs in those countries involves working horses, oftentimes those horses are left behind in terms of medical care and in terms of knowledge of the veterinarian, if there are even veterinarians in those areas. We've been working to try to help close that gap. So we've got multiple programs in countries Peru, Guatemala, Honduras, and here in Costa Rica currently. The Horse Plus Gelding Grant have enabled us to provide more care. These trips are not inexpensive. The equipment, the medications, the supplies, we rely on donations in order to be able to do this work, to know that Horse Plus is able to help contribute what they can to this process allows us to do more of these types of projects than we otherwise would be able to do, and to help more animals and more communities. And then also the horses in these communities are working horses, and the connection to these more rural communities and also the indigenous communities that we can create with these students on these projects becomes a really nice piece for us to continue promoting the welfare of these horses in these more rural communities. We've made it here to the La Casona region. We're closer now to the Panama border. And we're staying here at a farmhouse where we'll basically camp on the veranda of the farmhouse. This afternoon we'll kind of go and organize everything and get ready for our first work day tomorrow. We'll start bright and early and hopefully have a day full of good work tomorrow.
Make it dull or
We're here this morning. It's our first work morning. We're at a site called La Pita. It's part of this indigenous region. There's multiple little communities within the indigenous region. Our group today consists of CREW, which is Costa Rican Equine Welfare. They're our main coordinator for this trip, take care of a lot of the logistics. They've done work here in these communities for even going back before we started coming. I've got one other American veterinarian with me, and then we've also got 8 veterinary students from the Costa Rican University, Universidad Nacional, and then we've got 5 zootechnica students from one of the other schools here in Costa Rica, which is basically like an animal science program. We're gonna get our gear unpacked and set up our stations. So the horse comes to the work site, CREW does the registration. of the animal. Each horse gets an individual number for the day so that we can make sure that their medical record tracks with them through the different stations that we set up. So that intake area is responsible for that information on each animal. They also get a weight and a height on the animals as part of the information that they want to collect. The horse then moves to what we call our intake station, where we'll do a physical exam on the animal. And if there's no other services required, then the animal will get vaccinated and dewormed at that time. And if that's all that needs to be done, then that animal's finished with that station. But we also have surgery station, dentistry station, a farrier station. The animal will proceed through those different stations depending on what they're here for. We're getting ready for our first castration. This is a 7-year-old stallion. We're just getting organized and getting ready to anesthetize the first horse. One of the things that we worry about here are how far do they have to walk to get home and whether they have to cross any rivers to get home. We don't want the horse swimming. That's dangerous, and we don't want the incision bathed in river water. We make sure we talk to the owner before surgery, and we tell them that if they're having to cross any river where the water is higher than the horse's knees, that we don't want to castrate it here today. If they cannot get it home without crossing a river like that, we can try to find somebody here in the community that is willing to keep the horse locally for a few days before it's safe for the horse to travel through that river.
Eso es solo para calmarlo un poco. Thank you. Gracias. My job today is the head of anesthesia. So we're going to be examining the horses when they come down from intake, listening to their hearts and lungs, assessing their weight, calculating drug doses, giving a pre-med with some xylazine, which is a sedative, to calm them down a little bit so that we can get in an IV catheter so that we have venous access throughout the procedure. And then when surgery team is ready, we'll go ahead and top up the xylazine, make sure they're well and sedated. And once they're well and sedated standing, we'll go ahead and anesthetize them. And once they're down, we'll position them correctly for the procedure that they're having. This one's castration. And then anesthesia team will be in charge of monitoring heart rate, respiratory rate, eye movements, body movements, give additional drugs as needed to keep the patient fully anesthetized and well monitored until the procedure is completed. And then we'll go ahead and hand recover each patient to the best of our ability in the environment provided. My name's Andrea Satella. I live in the Hudson Valley of New York, and I am an equine veterinarian. At home, I primarily practice sport horse medicine, lameness, dentistry, and chiropractic. My father was born here and moved to the States when he was 18. And we had come as a family many times, and I had always wanted to participate in an Equitarian Initiative trip. And last year the opportunity became available, and the trip was to Costa Rica to the Osa Peninsula. So that was my first trip with EI, and this has been my second trip. You know, population control in a situation such as this where horses are roaming free, you know, horses aren't even being kept in their own herds. They're probably mixing herds with other horses. I think castrating these horses is extremely important, not only from a behavioral standpoint, but obviously from a population control standpoint. From what I'm told, because obviously this is only my second year involved in something like this, it's been something that they've seen over time, the owners more and more willing to do, because before the mentality was that it wasn't appropriate to take a horse's manhood, so to speak. So you can tell the education that CREW and EI has put into these communities and how they have really taken that with value and shown up specifically for castration. They're not being talked into it.
These programs give me a chance to utilize what knowledge I have from my career that was very good to me, a profession that's been very good to me, and with horses that have given me so much. And it's a chance to give back to all of that, my profession, as well as to the horse world in general and to horses. It's also a chance to work with these students, try to help pass on some of that knowledge, give them an opportunity to learn. I, get so much out of these trips. It really feeds my soul. The castration went fine. He was a little difficult for anesthesia. He wasn't terrible, but he required a little bit of extra medication for the anesthesia, and so his recovery was a little bit rougher than we would like, but he stood up great and he's nice and strong. That's my biggest fear, is when they try to stand up and they're still very sedated. If the actual anesthetic, not so much the sedation, but if the anesthetic hasn't completely worn off, they don't really know which direction is up. And so if they're really dizzy, then they can somersault and hurt themselves. So it's really important to make sure you're controlling what you can when they're recovering so that you try to keep them from hurting themselves or somebody else.
He went into a castration surgery, then he went into the dental station. He has some really big sharp edges on mostly on the cheek side. My name is Dr. Adolfo Cedeño. I'm a veterinarian here in Costa Rica. I'm mainly focused on equine dentistry. That's pretty much my practice. De este lado sí está con sí está mordiendo bien, pero sí está levemente trabado. De este lado sí está más libre. I work all around Costa Rica. Wherever they call me, I will go. So I travel all around the country. That horse uses a bit, so he also had some bruises and issues on his bars because of that being so tough on the bit, and he was cutting because of that, some hooks in the back. We balanced them out, we correct the angles, we took off the sharp edges and everything so he can be more comfortable and he can be a better horse. Crew, they needed a veterinarian to be part of it, and because they're bringing other veterinarians to do procedures, because the laws in Costa Rica, they have to be a licensed veterinarian. I'm the one filling up paperwork and my name is under there. So I have to be part of the team to make sure everything goes into legislation. And I'm the licensed vet in charge of pretty much everything. Right now what we're seeing is it's an old mare. She's 20-year-old or plus year old. She has some sharp points that we're taking out. It's lacerating a little bit the soft tissue, the cheek side. And she also, because of age, their teeth are wearing out mostly. So we have to try to manage and work with what she has. She's not well balanced. She's off, some of the teeth are off angle. So what I'm gonna try to do is put back at their angle so she can actually chew better and get a little bit more weight. But well, she has old teeth practically. And that's where we have to try and manage with and work with. I love sharing my knowledge. I like what I do. I do love my job. Teaching the students, it's fun to make them realize in real life, because in vet school, what they have about equine dentistry is just so poor. And coming into here and into the field with a qualified professional, I think they get a more into depth of that, and so they get a really more interest and the importance of what the welfare of the horse is going to be if we give them better treatment and better dentistry for their horses. This red roan gelding, he had a retained baby tooth that was causing the permanent tooth to shift towards the inside of the mouth, causing some diastema and food packing that it will cause in the future gingivitis. What we recommend in those cases is to extract the baby tooth and just wait for the permanent tooth to shift back into his position so he can have a better movement of the mandible. And to avoid losing two permanent teeth because of gingivitis, pretty much is like.
So we're giving just a little bit of xylazine, like the last horse, as a pre-med, flushing that xylazine in through our catheter, and getting ready to induce anesthesia for another castration. The most important thing I want the students to learn is what I call the dance, or the sixth sense of anesthesia. You know, obviously as students, they're prepared with the mg per kg dosing of the drugs. They know the strength of the drugs. They know the way the drugs are supposed to be administered, what the action of each drug is. And that's wonderful, and they need to know that. But then to apply that in a field setting and to know the feel of a horse's anesthetic plane and recovery without any monitoring equipment other than a stethoscope and their eyes and their hands. And I think that that's really what I wanted to impart on them. So voy a empezar mi timer de 5 minutos.
Okay. Yo llevo con lo que llamo de anestesia.
Sí, yo puse la anestesia inicial en el papel.
A las 10:30. ¿Y qué lo puse?
Yo puse 10:37.
Okay.
This time around was to really get that feel for the anesthesia, the feel for, yes, they know the horse's weight, they've used a weight tape, but getting an idea of what they think the horse weighs. Yes, they know the calculated dose, but is it a horse that could probably use a little less or a little bit more? and they all did such a great job of feeling that out and learning. It's very amazing. Castration number 3, my friend. Same procedure as the last. Xylazine, ketamine, diazepam.
Day's going well so far. We're moving along through the list of castrations. Everything so far so good. Nothing really abnormal. I just checked one of the castrations that was on our list, and he is an abdominal cryptorchid as far as I can tell. He was very good about letting me palpate him, but I couldn't find any hint of a testicle, and he was letting me get way up into his canal with still no sign of any testicular tissue. So I think he's an abdominal crypt, and we're not set up to do abdominal surgery here, so we're not going to try to go after that. But we have another cryptorchid that was the horse after that I can feel the tail of the epididymis, and we're going to go after his. I don't think we'll have any trouble getting that one done.
So we're going to do a castration of this horse, this stallion. We think his testicles are inguinal, so it's a little bit different castration, but we're going to palpate them and we're going to decide it. I think we're going to do it. We're going to just see first.
Let me see if you're in the canal. Let me put my fingers on it, and then you can find it with my fingers. Right up, okay, right here. Okay, gentle. Suave. Poquito más arriba. Right there. Yeah, and then just be really gentle. You don't want to push really hard. Just gentle and push up higher, but push against the leg.
But I don't feel the testicle.
But you feel something in the canal?
Yes.
There's something in that canal, right?
Yes, but I don't know.
You don't know what it is, but you can feel that that it's not an empty canal.
No, it's not an empty canal.
Right, so I think I can grab that, and that's going to be the testicle.
Okay. So?
I think so.
My name is Isabel Céspedes. I'm a university student. I'm a vet student. My work here is to learn and help the communities. I go to school in National University here in Costa Rica. I'm in my last year of university. In this castration, my job is assist the Dr. Neil because it's a different procedure. So I have to learn from Dr. Neil. So my job is assistant.
So this horse is a little bit more challenging because of that small right testicle, but we can feel it now, especially that he's under anesthesia. And I think we're going to be fine. So what I'm going to do is dissect. Okay.
I've been helping the doctors, assistant, and learn from them all the procedures. I help with the castrations, I help with dentistry, intake, we take parameters, we check up general health of the horses. So that's what I do, helping the doctors, learning, explaining to the people how we can help the horses.
Do you have the bistri?
Yes.
Yeah, I'm going to cut this little piece off here just because I don't want it to leave it there. So this horse just got finished being castrated. This was the one that had the abnormal right testicle that was very small. It was there, and it was actually external to the inguinal ring. After the castration, we put some SWAT fly ointment around the area just to help keep flies away. And then on the incision, we use an aluminum spray. It acts as like a liquid bandage. The horse receives a dose of flunixin, which is an anti-inflammatory. And the anesthesia is done with ketamine, which is actually a very good painkiller. So one of the effects of the anesthesia is also analgesia. And the effect of the ketamine lasts longer than the anesthetic effect of it. The analgesic effect actually lasts longer. So we probably get actually up to 24 hours of some pain-killing effect from the type of anesthesia that we're using. But we do use a dose of Banamine or Flunixin is the generic name for it. And the horse does receive a dose of that. And they also are receiving 2 doses to give by mouth tomorrow and the day after. Which are usually those first few days are when you're going to get the most inflammation. So it looks like we're about ready to start on the last castration of the day. Everything is getting prepped for him, and we'll get him done and call it a day for the surgery department.
Well, this is my last horse I have for the day. Of course, he has some sharp edges, some ramps. His lateral movement was a little bit blocked, and but yeah, it was pretty straightforward, pretty standard horse. We can find. It was a young horse, so it was not a big deal to find anything too big. It was a pretty long day. We did 15 or 20 dentals, and different cases, mainly all the lacerations. It's the most problem because of the sharp points. Horses are dropping feed because they are in pain while they're eating, or they have a locked mandible. They can't move their jaw properly. So we help them with that. We saw some old horses, 20 something plus. They have pretty much wear down all their teeth out to the gum line, so they're gonna have a hard time, but we help them, make them a little bit more comfortable in the mouth so they can actually eat a little bit better. We'll see how it goes tomorrow.
We're reaching the end of our work day. We're still gonna sit down later with the students and go over how the work day went. We'll do some case evaluations and case presentations with them, but we're done with our field work for the day. We ended up castrating 7 horses. There was 1 horse, the abdominal crypt, that we didn't do, unfortunately, but otherwise the surgeries went great. I think we saw around 57 or 58 horses total today. Everybody got vaccinated and dewormed. We've got another community when we're gonna start working in tomorrow at 9, which is about a 2-hour drive away. We'll head down to the next community and start working again tomorrow. We're here, made it without any incidents down to Coape Agripal, the palm oil plantation where we'll be working today. Should be a good day full of work. We've got the first surgery getting ready is going to be a horse that has a tumor growing on the edge of its eye and invading its cornea, probably a squamous cell carcinoma. They did have a veterinarian that had been able to try to reduce the tumor a couple of times, but it keeps growing back. So this morning we're gonna go ahead and take that horse's eye, because otherwise that tumor is going to keep spreading and likely end up being a reason for that horse's demise.
Today we're at a community that it's called Coape Agripal. We're going to work with some of the mules that help with hauling the fruit of the palm for fruit of the palm oil. And this is going to be a day where we're working, just doing intake of these animals, measuring them, their weight, their height, just making sure that there's no injuries in their body, checking out their body score condition. We ask the owners about their nutrition, what they give the animals, what they feed them, how long are their working hours, how many days a week they work, and basically what their husbandry practices are with the animals. My name is Lisa Ortuno, and I am the Executive Director for CREW, Costa Rica Equine Welfare. Right now, we are doing our weekly community visits in the south part of the country. Over here, we visit several indigenous communities and then other working equid communities. The focal point is to be able to examine the horses, examine their welfare, and see if they have injuries, what their hoof condition is, if they have any parasites, any mistreatments from the human-equid relationship, and to make sure they have the proper nutrition and the proper body score condition. There goes our 2 first patients. After we do this basic intake about welfare, status, and condition, and what they do with their animals, then they go to the veterinarian stations to do whatever they have to. For this first 2 horses, one is getting a castration, second one an inoculation, and after that they already had their hoofs trimmed, and they're gonna get their deworming and vaccinations, and just make sure that they're ready to go back home. These are ticks. So we have a lot of ticks around in the area. It's normal. And because we're in the tropics, they get worse and worse. So we try to give the deworming so that they fall off and so that we could improve their health. For this week, it's important for us to also not just come and check on the horse's welfare, but also, since we have a strategic alliance with Equitarian Initiative, they come over and assist in all the health care issues of those horses. So as we do the inspection and get the routine of what recommendations we need to give the community and what we need to work with them in training and to make sure that the conditions are better for the animals, Equitarian always comes and helps with the health.
It's not really distorting the lateral canthus too much.
¿Por qué no le damos a este caballo unos 2 centímetros de xylazine para que se relaje un poco?
So the tumor itself doesn't look like it's distorting the side of the eye too much, but you can see it's pretty uncomfortable, and he's blinking a lot and irritated, and the flies are all over it. It's going to be much better off without this eye. I don't think he's seeing much out of that eye. There's probably a little bit of vision left in it, or at least a cloudy vision left in it from the quick look that I got at it. He's tired of people messing with his eye, so once he's sedated, we'll get a little closer look and I can palpate the little deeper, but I'm not going to poke at him right now since we're just going to make him more angry. So once he's sedated a little more, we'll make sure that our surgical plan is the way we want to proceed, and then we'll start working on him. That's the eye. What we do is we make an incision just behind the eyelids on both sides, an elliptical incision, just basically so like you were going to cut off the eyelids, but only through the skin, not the entire thing. And then we're going to dissect underneath our incision all the way around the eye, using like a blunt dissection to go around until we can completely remove everything together.
Si precisan algo traducido, me avisa if I need to translate.
Yeah, exactly. I told them to stop me if they're having any questions. What I like to do is I use a towel clamp to hold the eyelids, and then I can use that as my handle. And I want to dissect the bulbar. I want to leave the bulbar conjunctiva intact. So I'm taking everything, including the bulbar conjunctiva. We're not going to put anything in, and we're not taking just the eyeball. We're going to take all of the surrounding tissue because of the tumor, especially because it's a tumor. And generally speaking, in horses, that's mostly what we do anyway.
El squamous cell carcinoma tiene tejido, tiene raíces feas.
Sí, sí.
No sacan solo el globo ocular,
Lo que está diciendo, se saca todo.
The optic nerve also has the vessels. We're going to put, once we have this free, we're going to put a clamp on that optic nerve, and then we'll put a suture. We'll do a circumferential suture around the optic nerve for the vasculature, and and then once we're done with that, I usually don't even have anything else I try to suture except the lids. Bueno, perfecto. Bueno. Yeah. Yeah. And there's some eye ointments in the pharmacy box if you want to give them any eye ointment. But,
Once we're settled, I'll go get it.
Okay, I'm gonna go ahead with my retrobulbar and then we'll clean. So let's start scrubbing that.
So flunixin vamos a hacer 9. El exis.
Okay, the scalpel is what I'm gonna need first. The bisturi.
Flunixin 9, exis, una dosis.
So my incision is just along the eyelid margin, and then the same for my upper eyelid.
It's been a process to start working with the communities. It's always difficult to come in and to try to tell how to make things better. It's not going to work as easy as we think. So the best thing that we always do is find leaders here in the community and people that are more aware and that know that they need to change some of their habits with the animals and their husbandry practices. And so once we do that, we start with our education part and then with the brigades and the veterinarian brigades. And I think it has been working very well. As I say, it's a process. It doesn't happen from one day to another. It takes time to get their trust and confidence and for them to come and give us their horses or their mules or their donkeys in our hands and let us do what we need to do. It's always an education process, so we need to make sure that they're well aware of the needs, of the importance, and to understand that we want to help. It's not that we want to critique or make things worse. is that we want to hand by hand with them, help them with their animals' welfare so that they could all benefit from it.
Futura, por favor. Gracias. So we're here with Chaco, who we had to take his eye out because of the tumor that's been growing there. Chaco did really well with surgery. He's up and he's going to be a whole lot more comfortable without that tumor in his eye. And we took as much tissue as we could, felt that we got pretty good margins from what we could tell. Hopefully there's not any tumor left behind. There's no great way for us to tell here whether we're completely successful in getting rid of his tumor or because there certainly exists the possibility that that may come back. But hopefully we've gotten rid of it for him. The stitches that are in there are going to dissolve on their own, so nobody has to take those out. And hopefully Chaco just gets to live the rest of his life without tumors and get a nice pain-free situation out of the deal.
¿Cuántos años tiene?
Él tiene 2 años y un par de meses.
¿Y usted de tenerlo, más o menos?
4 meses.
¿Y qué tan largo queda de aquí?
20 minutos, 25.
¿Y venía a pie o venía,
no, venía en camión? Pero yo lo voy a decir sincero, yo lo iba a llevar mañana a Santa Rosa, no sé.
Okay.
Ajá. Pero el problema es que tenía que dejarlo allá y no me estaba gustando mucho.
Hi, I'm Gretel Solano Mora. I'm an animal science engineer. My main job in crew is work as an assistant to the director, working on reports, taking data, analyzing the welfare data that we take in our field trips. Also, I work in the investigation department of crew, where I work with the students and other professionals to generate investigations all around equid welfare. He actually had a very good body condition score, and the hooves were good. And he has a little of the issues I can see with this exam is a little bit of tics, but nothing to worry about. Today he will be dewormed and everything that should take off the tics, so it is good. It's very good. Entonces, acá lo que se hace es, en mi caso yo me pongo los guantes para no contaminar a los posibles otros animales que tengamos que atender. A pesar de que estamos haciendo un bien, vamos a hacer un mal. It's very important that the students know the importance of the relationship between the animal science engineers and the vets, so we can work as a team. So that's the main thing I try to encourage with the vet students, to have this relationship between careers. And I think that's the most important part of my job when teaching to the vet students. The white one, she is a very nice horse. She has a very good condition score, but the owner told us she almost doesn't work, so the condition of those horses tend to be better. The condition of this mare is very good.
Eso es, muy bien.
Puedes revisar a ver qué
Ok, haga el otro lado, de una vez.
My name is Mitzi. I study veterinary medicine in the National University in Costa Rica. Ha sido muy bueno, es mi primera vez y nunca había hecho nada acerca de dientes. El doctor Cedeño tiene mucha paciencia y me ha enseñado acerca de todo, cuál es exactamente cada diente, las arcadas, la maxila, la mandíbula y cuáles serían los problemas que podrían estar ocasionando que haya algún problema en el animal, como de desnutrición o algo similar. Entonces, hoy hemos tenido 3 casos, hemos hecho extracciones, hicimos 2 extracciones de dientes de lobo. Sus dientes quedaron muy buenos de verdad, lo cual va a mejorar su alimentación y va a hacer que el caballo se pueda alimentar de una mejor manera.
One of the other vets noticed there were some wolf teeth, some tiny little vestigious teeth. Normally they affect with the vet, so we recommend to extract them. And while we are opening his mouth and doing a thorough exam, we found out there were some baby teeth loose in the front teeth, they're incisors. So we pulled them out so the permanent tooth can erupt normally. We took up some points. He had some big hook causing a big laceration on the far back of the mouth. We balanced everything, and now we finished with the horse, and now it's really, really nice.
Everything's going really well so far. We're getting through most of the castrations. We've got 2 to go. The one horse behind me was the last one we did. He just stood up really nicely.
We've got a mule, that direction behind me is going to be our next castration. Mules are a little bit different. They require a little bit different dosing on the anesthesia regimen because they metabolize those drugs a little bit more rapidly. And so you have to give a little bit higher dose. Then we've got one horse left after that to castrate today. I know that the other stations look like they're wrapping up for the day a little bit as well. And I think everything's going well so far.
Being able to assist these communities that rely on these animals so deeply for their livelihoods, for their day-to-day lives in a way that the horses, certainly in my practice in Los Angeles, California, that was not the role of horses. And for me to be able to help these communities take better care of their horses gives them better horses that help care for them.
So we're finishing up our day. They're packing our supplies in. We only have about a 10-minute drive down the road to where we're staying tonight, which is really nice because we're all getting pretty tired. The day went great. We didn't have a lot of patients today. Today was actually not supposed to be one of our working days, but we had to readjust our schedule a little bit. This worked out really well because it gave us a chance to really spend time on each horse with the students to allow the students to be more direct hands-on on some of the surgeries and some of the surgeries that were a little bit more difficult. So that was great. I think the students got a lot out of it, had a great day. We're gonna actually be back at this spot on Friday morning to finish up with some other horses in the community. Tomorrow, we'll drive about 45 minutes or an hour from here to a community called Santa Rosa, another indigenous community. And usually that site, we've got a lot of horses, probably anywhere from 60 to 100 horses tomorrow. So we're gonna clean up and rest up and be ready for another day tomorrow.
Today we are going to work in a community named Santa Rosa. It's part indigenous community and part non-indigenous community. It's gonna be a really rough day. We're gonna get more than 50 horses and some mules also. It's a mule community. They also do the cropping of the fruit of the palm oil, and then they usually use their horses for regular human transportation or crop transportation around the area. Hola, chiquita. ¿Cómo estás? Yeah. Hola.
My name is Diana Arguello, and I am a veterinarian. I was born here in Costa Rica, but my family is also Nicaraguan, so I actually studied my profession. I went to vet school in Nicaragua. Ever since I was in vet school, I was able to volunteer with NGOs like Equitarian Initiative, and that's where I knew immediately that my passion was horses and that I like to work with working equids. We're working on for the intake part of the project, where we take the horses and we do their physical examination, and we apply their vaccines, their dewormer, and their meds for their flea and tick medication. 6 years ago, I came back to Costa Rica and I started volunteering with Equitarian Initiative, first in the Costa Rica, one of the Costa Rica projects. And 2 years ago, I started coming to this one too and helping them with this project too. I also volunteer with the Peru project and with the Nicaragua project. This part is very important because it's what we call like the first line of of knowledge or importance for the students, where we focus first with any student that is just starting or it's in the lower years of the career. We would teach them first to just have like a general observation from the distance always, just to kind of figure out what's their attitude, if there is something very obvious, that something sticking out, or a wound, or just like an immense load of ticks like you can see in this one, in the eyelid, right? That's all ticks or tick eggs. And also in the ears, you can see them very in a big one. I always start thinking like, okay, if there's white skin and the face, then I know that it's something I have to tell the owner and explain the owner about the importance of protecting the skin from the sun. So those kind of things I kind of look through. Obviously, I also most of the time figure out if it's male, female, right? Just obvious stuff that you can tell from the distance without really starting the process of making him anxious or stressed. My role in the Equitarian Initiative is mostly the education with the students and the owners. And I also help with anesthesia, and I have like a role of like organizing and making sure that the flow is working with the students and the patients. And I really like it. I love going into communities and just teaching what I know to the others and learning from the other vets that come to volunteer with EI. What she was giving in a topical way, it's the flea and like the tick medication in this case, and and her vaccine, which we need to put, will be applying it IM in her neck. Con menos de eso, no hagas tanto para atrás. Realmente con solo que medio lo movas hacia atrás, ya aquí si hay sangre la vas a ver aquí de un solo. This is something very important that we've been doing owner education in other programs about it, because in these conditions where there's no vet around and they almost just see us during the year, they will need to put an injection from time to time. So we've been explaining to them where so that at least we know that it will go on the right place, right? And no big problems like big abscesses or other worse things happen. If the ligament is here and the bone and nerve and blood veins and arteries are here, then we have like a small triangle. We have a triangle zone where there is only muscle, and it's the best place for an injection. The blood samples, we're taking them just to do like basic lab work, hematocrits, just to count the blood cells, see how her general nutrition might be doing. We're also testing like the protein level that will tell us how well she's hydrated. And we will also be doing some DNA test. We'll see how this mom is doing. The pregnant mare that we were doing the physical exam on, she is overall, just in the physical exam, it looks like she's healthy. She had her vaccine, her dewormer, her tick med, and we also decided to send her to the hoof station. Just in general, I like to send pregnant mares to the hoof station, because I feel like what better than a hoof work to make them a little more comfortable with all that extra weight. Working with the communities is very important, because it's a way of giving back everything like that, and also with the students. In a lot of the universities in Latin America, or at least in Central America, it's very hard to get practice, or like you go to the university, but it's very hard to go out to the field and actually practice what you're learning. So I love helping give this, like the students, the opportunity to learn as much as they can. I also love to see how it changes everyone. It just changes everything, like the perception of the world, the perception of your profession. It helps you know for sure, like remember why you started to do this in the first place. Because back in like the usual day-to-day activities, sometimes you lose that sense of why it's so important, or how much we love animals, which is why we started to do this. And in this type of work, you learn to also love and appreciate the people in the community, which is kind of hard for a vet student. They will also say, I love animals, but it then becomes like, I love animals and the community, like at the same time. In general, in these tropical countries, for some reason, they love having white horses with white skin because they're pretty. Of course they're pretty, but their skin, they're constantly under the sun and in these conditions. So they tend to always have sunburn in their skin. And we've seen several cases of squamous cell carcinoma. So I always like talking to the owners, explaining them that that's a possibility, that there's sunburn, and maybe there are ways, not exactly to prevent it, but we can still try, right? So I was telling the owner that there's something as simple as the baby ointment that you put so that babies don't get burned, like in their diapers. Then that is something that they can apply in the skin, and it will help them not to get burned. And also it has like a water resistant property, so it won't get washed away as quick as if, for example, they could put just general sunblock, but the sunblock they would have to reapply like 1,000,000 times more. So it's just ideas, right? It won't probably be excellent, but it will help. I also like telling them that a lot of that sunburn is really, really painful. Like just like when we go to the beach and we like have extra time under the sun, like, and we don't like to get touched or like right? So that happens to horses too. And sometimes they say that their behavior is bad, but they have these robes in their head rubbing them all through the sunburn. So you can't blame them, right? So I try to like put that aspect in place, that it might not be it's not a bad horse, it's just it's painful, right? This is a baby. He's only 6 months old, and he obviously is not like handled much, so he's not used to so many people and people grabbing him, right? So now that when they come like this, once we grab them, then we try to be as fast as possible and just do what we need to do so that he can just be free and not be like afraid. So we took just like, we didn't do a whole physical exam. We took the basic vital signs, and we did the temperature. What she gave orally was the dewormer. It's a different dewormer than what we would give an adult. And she gave also a vaccine. And I'm sending him home with an extra dose of dewormer to give in the next 6 weeks.
So we're here with this 5-year-old mule that we're gonna work on a sarcoid on the inside of her right thigh. A sarcoid is a virally induced tumor, and she has about a 3-inch long tumor that it has an ulcerated portion to it, which means that it's open and bleeding a little bit. The flies are bothering it. So we're gonna try to take a piece of that tumor and process that a little bit and do what we call an autoimmunization. So we're going to use a piece of that tumor to try to induce an immune response in the body to try to see if this mule is able to get rid of that tumor herself. So we'll take a piece of that tumor off. We're going to do a little treatment to that to sterilize it and to cut it up into little tiny pieces, crush it, and we'll put a little pocket with that material in her neck. We call that a marsupialization of the tumor. We'll see if we get a proper immune reaction from her that way that'll help her get rid of the tumor. That's our plan, and that's going to be the next surgery. It's not very fragile tissue, so it's different. It behaves differently than like a granulation tissue. So I'm just going to work on this to get little pieces. The formalin's going to denature the proteins in it a little bit, and help. It's not obviously not a sterile thing. I don't want to spread the tumor, and there is a risk, and we explained to the owner that there is a risk of spreading this by doing this. Even sometimes just by cutting a piece off like I just did, it'll aggravate the tumor and it just grows more. So it's always a little bit of a chance, but we think it's worth the chance for what we're doing. I'm also going to put some topical medicine on the tumor to see if I can get an immune reaction that way. I don't think the owner is going to be able to put medicine on that tumor every day. Otherwise, I would love to be doing that. I have some topical medicine that could help reduce it. But we're going to just take this. We're going to make a little incision in her skin, and we're going to put some pieces of this in there. We'll see if we can get her body's immune system triggered to produce a reaction, and actually the other tumor should regress if that can occur. I'm just going to take this, and I may enlarge my pocket with these mosquitoes. That's what I was going to use those for. Okay. Is to just take and put it in my pocket, stretch it out just a little bit, so I have a nice little subcutaneous tunnel. And then I'm going to take my material that I was chopping up there and just put it in that little tunnel. Like that. Okay? Put one little stitch in that and we're done. And that's all we got to do, and we're done. But we're going to put a little medicine on that sarcoid, because this medicine hopefully will also create a little immune reaction here too. That's the goal of it, and we'll see. I think everything went fine, and the anesthesia went great. It's a really, really fast procedure. So she's up and happy, and we're done, and we'll see how this works.
It's important when we want to send treatments, sometimes it's hard because there's owners that are not going to follow instructions, and some that will be. So this was a great owner for the treatment too, because he's very involved. He has a good handling of his horses, and we do make sure that they know that with the Xterra treatment, the sarcoid will only get worse and very nasty, and it will be really scary to see it before it starts to die and get better. So we make sure to tell the owner that, and he was comfortable with it. So hopefully it's going to be a success.
Ve las 2 7 de arriba, mae. Sí, exactamente, son unas ETRs. Okay, eso es todo, mae. He has a couple of ramps, some ETRs, some steps. Pretty much standard, what we mostly find in this type of horses that are eating in pasture. But it's pretty standard, but this horse is having some issues eating, so maybe he's in a little bit of a pain, so that's a little bit what we are trying to avoid, so he can eat better and get a better body condition score. One of the most important things that we teach is, well, how to identify the problems. Why are we making a difference in that correction? Why we do that correction? That's the most important. They know the anatomy, they know the physiology, they know everything. But when it's applied, we need to show them why is it causing a problem or not. We teach him also how to use the power equipment and how to equilibrate the mouth better, or to get them more skills to create a better balanced mouth in the horse.
So there's a horse that walked from a far distance. We're suspecting that it's very anemic. Its mucous membranes are very white, delayed capillary refill time, has a systolic murmur, which is typical of a physiologic murmur from anemia and dehydration. Was thought at first to have diarrhea, although did pass some normal manure here. Covered in bat bites, and the penis is full of screwworms. So has a long way to walk home. Obviously, we don't want to vaccinate him. We don't want to sedate him, and we don't want to anesthetize him. So we're going to go ahead and attempt to do a pudendal nerve block underneath his tail, between his legs, to see if we can get him to drop his penis without sedation and remove the screwworms. His bat bites have been scrubbed and cleaned. And we're also going to give him some IV fluids to help him with his hydration status and his trip home. And we're going to forego vaccination and deworming due to his health status at the moment.
Hi, my name is Jose. I'm a vet student right now. This is my 6th time with Equitarian Initiative. I feel like every trip is different. You learn a lot from the community, the students that are able to be here, and the doctors from the United States. So it's a good thing for us to learn from doctors from other countries, and also an excellent experience for you to practice as a student. They let you do a lot of things that you don't get the chance to do with horses in the vet school. And it also is a good thing because you can talk to the owners and also see the realities in this kind of community.
Si lo oís más del lado izquierdo, probablemente mitral, más del lado derecho, probablemente tricuspid. Típicamente los murmurs de physiologic murmur son el mitral, pero no se sabe sin un eco.
It is also like a learning process, but it has like a lot of elements that you can work on, like with the communities, with people. So it is and the owners really appreciate that you come here and help them, because this community doesn't have access to a general attention for their horses. So it has like a lot of elements that are important for us as students and for the communities also.
He's using a pair of hemostats to remove all of the screwworms from the tip of the penis adjacent to the urethra. And there are probably at least 100 of them. But there's another parasite that visually grossly looks the same as this one, and it's reportable because it's eradicated in Costa Rica. So they took some separate samples to send to the state to make sure that it's not the reportable type of parasite. The procedure went very well. 5 liters of IV fluids, and it perked him up. And we went ahead and performed the nerve block, removed the screwworms, and they are I got the name for you guys, they are being sent out to rule out what's called gusano barenador, which the scientific term for that is Cochleomya hominivorax, which is a reportable disease in Costa Rica, which is thought to be eradicated. One of the local Costa Rican veterinarians who's with us feels that he thinks it might be that one visually, grossly. So we kept some aside to send out to the state lab. Our patient is over in dentistry now. The veterinary dentist feels he can take some points out of his mouth without having to sedate him. So that's wonderful. And then if he's doing well, maybe we can trim his feet. And he's got a 5-hour walk home. He did a 5-hour walk to get here today. So hopefully his owner will be able to find a place to rest on the way home. He said he has a couple friends on the way home from here where he might be able to keep the gelding overnight so that he doesn't have to walk another 5 hours.
On these types of projects, it's not unusual at all for somebody to have walked 3 or 4 hours to come to one of our work sites. And that, to me, speaks volumes in terms of their desire to better care for their animals. It's not that these people don't want to do a better job or provide care for their horses. They just simply may not have the resources to do that. And so when somebody tells me that they have a 3-hour walk home after we've worked on their animal, it makes me understand the value of what we're doing, because if they've given up an entire day of their life to walk here that kind of distance and to be patient while we get through all the animals, and then to walk 3 hours back home at the end of that day, That to me makes me want to give every bit that I can to help them.
It was a good day. I think that part of it was that at the beginning, people are like a little lost on how to do things, on how to organize. But I think that the logistic and the students got the idea pretty fast. So I think that at this point of the day, we work like very well because we know what we need to do and how to organize quickly and things like that. It's a good thing for us to be a team and to communicate with each other. And I think that we need to go through like a messy moment, and then we can organize and get things together, yeah.
Okay, it is Friday morning and we are back at the Huape Agripal palm oil plantation, or processing plant, and the students' bus has to head back to San Jose. By contract, the bus has to be back at the school before dark. So we're going to have a bit of a shortened day with the students. We've asked the owners of the horses to come early so that we can try to get wrapped up early with the students, and we won't have a lot of trouble finishing up the horses, because our equipment has to travel on that truck because we don't have enough space in the rest of the vehicles to get all our equipment back. So should be a bit of a shortened day today. We do have at least one castration coming this morning. Hoping to see a bunch of other animals as well, so we'll see what shows up.
Today is the last day or 5 that we've been on the road, so it feels good to feel that we're close to the end. It's been a rough set of days, but everything has worked perfectly.
Yeah, we are a little bit tired, that's the truth. But I think it has been a very productive couple of days. We have been seeing a lot of horses, and that's the feeling accomplished that we can have about the good work we are doing.
Honestly, I feel really tired, but really happy about the experience. I learned so much in this trip. I practice a lot. I'm really glad and happy about that. I'm helping Dr. Cedeño today in dentistry, and I hope I learn a lot more from him.
It's hard to tell which part is it's my favorite, but I think meeting new people and sharing and trying to help, talking to the community, trying to talk to them if they have any questions, answering the questions, but pretty much meeting new people and meeting new places, traveling around, that's kind of like my preference of this. Also, I think helping those animals and try to come back the next year and see they have evolved or they have changes into the positive. I think that's one of the things that I'm more proud of, that we are doing a better life for those animals, for those working animals.
My favorite part is that I got the chance to do like another role, because I was like in a student mode, but now I'm kind of an instructor. So it was very cool to be able to do that in this point of my life, because when I came here, everything was like brand new and you don't know what to do, but right now I'm able to do it and to teach the students, and that's part of the mission and the purpose of Equitarian Initiative also.
These projects, I think, are an opportunity to connect with the greater horse world and the other societies as a whole that are different from ours. We may be able to have some resources that they don't have. We're not better than they are. I'm not smarter than any of these students that I'm working with. They're wonderful students. The horse owners themselves are wonderful people. They just don't have much access or the same access to care that the animals that live near me do. And being able to have people see what we do, understand how this helps. So it's really important that our society that has so much, and that our horse owners that have so much, help take care of these animals. It's our responsibility to help those who don't have as much as we do, and that don't have the kind of access to this care that we have. And if we can help them understand how to better care for their animals, those animals are going to be much better off. So the castration went really well, no complications. The student did a great job. He's done a couple in the past, so he only needed a little bit of direction, but he did a great job, and everything went beautifully. We've got one more to do, and that'll probably be the only other castration that we do today.
We're about to do a pregnancy check. We have an ultrasound, a butterfly ultrasound that is very practical in these cases. When we're in the field, we use alcohol in the area that we're going to check, and we will find out what we can.
Hola, soy el Dr. Maroto. Soy médico veterinario, me dedico a la práctica de equinos acá en Costa Rica, en la zona norte del país. Principalmente ayudo en medicina un poco deportiva, preventiva, un poco de reproducción, odontología. Eso es en lo que me desarrollo principalmente en mi práctica profesional. Cuando estaba estudiando, por ahí del 2015-2016, vine de estudiante a trabajar por acá y comencé a ver la necesidad que había en las zonas indígenas del país y zonas donde habían caballos de trabajo, ¿verdad? Había mucha problemática de cascos, de dientes. Ellos, como son de bajos recursos, no tienen mucho dinero para poder pagar a profesionales. Entonces, gracias a este proyecto junto con CREW, se ha podido mejorar muchas de esas condiciones. A lo que vamos es a que tengamos o esta gente de estas zonas rurales más preocupada por sus animales, o sea, que hay un verdadero bienestar animal y respeto hacia los animales. O sea, a la gente no le importa mucho la salud de sus animales. Entonces, yo espero ver en un futuro más amor por ellos principalmente.
The mare wasn't pregnant, so we decided to check the other organs in her body, like the stomach and the colon and things like that, but it was pretty normal, so...
Let's get him en los 5 puntos correctos, ¿verdad? Antes de dar la anestesia, okay?
Now stretch him out. Yeah, it's just to open it up a little bit. There you go. And choose a side and start. Deanna's done castration before, but it's been a few years since she's done one. And she just wasn't as comfortable since it had been a while, and she has used the Equitwister, but it's been a while for that as well, and she's only used it on a couple of occasions. So she just wanted to make sure that I was holding her hand a little bit through the surgery.
All EI projects have things in common, that they also have its peculiarities or things that make them unique. And this project is very unique because it's the first project of EI that is also worked along with CREW, with Costa Rica Equine Welfare, and UNA University as well. So it's very nice because it was actually one of the first projects to not be just about EI coming in. It's about EI coming and working alongside another nonprofit that takes care of the horses' welfare. So I really like that part. It was very interesting for me to be part of this project and see how everything kind of just blends and they work out. And also it has an extra element of having technique students, which we don't have in any other project of EI. So it's really nice just how very different random things just come together, and I think we make a good work.
So we're just going to clean everything up, Mitzi, and we're going to put all the instruments away like we had them, and we're done with surgery for today. Everything went great. The horse was anesthetized nicely, no real problems at all with that. One testicle was a little bit smaller than the other. We actually changed techniques for that testicle. There's a way to do it with the Equitwister, but it's a little bit more difficult, and since Deanna's not as comfortable with the Equitwister yet, it was just going to be a little easier for her to use the emasculator on that testicle. We just went ahead and used that.
It was better than what I expected. So no, it's nice to see things different in different ways, right? So I like that. I liked what we did.
I think overall it's been a fantastic week. We had a phenomenal group of students. They were incredibly engaged. They were all hardworking, wanting to learn. They learned a lot. They were open to learning, and I really enjoyed everybody that we got to work with, and that's what makes it a really great trip.